I'm a biomechanical engineer. I have a PhD in spinal surgery or development of materials for spinal surgery, combined together with optical engineering, microengineering. I had a very strong vision of being an entrepreneur. This is what I wanted to do with my life. And during my work in spine, I realized there's one molecule missing. And there was one professor from Switzerland. He had exactly the molecule I needed, and he was looking for a licensing partner for this molecule. And this is actually how I also met my co-founder.
When I met Andreas for the first time, it was at the end of my PhD at ETH Zurich. I was doing research on fundamental phosphorus chemistry, and I enjoyed doing that, but I was looking for something more applied. And I was really fascinated by the idea that Andreas proposed to me that allowed me to bring some of the research I was doing into real-life applications, and not only real life, but actually into medical applications that allowed us to help people in their life.
We realized endodontics is a big problem that needs to be solved for millions and millions of patients every year around the world. So we went for it.
We had at that time looked at orthopedic applications, neurovascular applications, and dental. When we researched further into that, we saw, okay, here we can really have an impact on a medical problem that most people will face at least once in their life.
What we did is we went out in Switzerland, in Europe, and also worldwide to the key events and told them this is our prototype, whatever it was at that time. And then we involved them into discussions, and then based on these feedbacks, we developed our technology. And this, of course, is essential to make sure that we get to a good product market fit in the end.
Looking deeper into the requirements, it became very challenging. We said, on the one hand, we want to have a low viscosity flowable material, which is radiopaque. Normally, what material scientists do to make a material radiopaque, they add powders of inorganic materials to induce radiopacity. If you do that, your material becomes a viscous paste, and that's not what we wanted. So this was one of the first big challenges, finding a material or finding a radiopacifier that allows making our material radiopaque, meaning you can see it on X-rays, while at the same time not making it too viscous.
The most renowned venture competition in Switzerland is venture.ch. We won that in 2017. The Swiss president handed over the prize. This was a very nice moment. So at the beginning we had Omnifil. It was an excellent technology, but when we went to key opinion leaders, to leading dentists, they said, that's great, but I also need to clean the canal. Get me also something to clean the canal better. And this is how we started the development of OmniClean.
And we started doing basic research into how can we induce cavitation inside a root canal, knowing that cavitation can efficiently clean surfaces. And we wanted to build a device that induces cavitation that is affordable, simple to use, safe, reliable, always works independent of the root canal shape.
And so our DNA from the beginning was listening to others. You may know a lot of things, but you never know as much as the people around you. And by listening, you can take in this information and give the people back what they need, or what is really helpful, what improves their lives, their procedures, the treatments for the patients.
Looking back at the development of Omnifil, I'm certainly most proud of our team that did hundreds of experiments under my guidance, like chemists making syntheses, engineers then making the samples, testing out stability, photocuring, all these things. And we really did that because I said, I want to make a material that's going to work.
To have the persistence, like Mark's persistence, the persistence of the engineers, the persistence of the scientists, the clinicians behind this is really remarkable. It was a difficult journey to get to the point where we are now, and also the next steps will not be easy. Our goal is to transform endodontics for every dentist in the world, for every patient in the world.